Hello, everyone. It's Dr. Blatz from Maple Medical. I just wanted to go over a case that we're actually performing today. So this is a gentleman. We actually did his right shoulder a few years ago. He did really good with that. Comes back for his left shoulder. And as you can see on MRI, we have a very large humeral cyst with some bone marrow lesions along the brim of the humerus. Here's an axial shot of this. And as you can see, there's a very defined cortical border on top of that. And we'll take a look at that on ultrasound today. You can also see the trajectory towards this bone marrow lesion. So our goal today, we'll find that shell on ultrasound, penetrate that with a needle, flush that out and decompress it, and then actually utilize the back wall of that to provide a needle into this space back towards the joint line so we can provide some bone marrow and PRP for that space to help heal that. Thank you. Okay, so now we're here in the procedure and we're ultrasounding the infraspinatus of this left shoulder. And you can see the cortical change that's on the humerus there associated with the infraspinatus tendon tissue over the top, and that directly correlates with what we saw of that shell in the MRI. And you can see a little bit of that shadow curve below that space, which is the cyst that we're going to be after. So we just used an 18 gauge needle to pierce that shell of that cyst and got into that space. I delivered about 4 to 5 cc's of saline to wash out the cyst, and then we drained it and aspirated it. And then I have a 3.5 gauge needle in here now that I utilized to go through the back wall of that cyst into the rest of the humerus, because we needed to infiltrate intraosseous to be able to hit that humerus with some IO bone marrow to help with the arthritis. So now we're in the rotator cuff just above the cyst, and we're providing some PRP and microfragmented fat to fill in the deep partial tears of infraspinatus and supraspinatus.